without further ado, Miss Cynthia, you have the stage.
Thank you so much. I'm so excited to be here. We are going to talk about my favorite subject. So just so you know a little bit about me, I have a 24-year-old son with autism, and I've been navigating our systems of care here in Arizona for 21 years. I'm an expert in insurance, especially Medicaid. I sat on the governor's advisory committee for ASD for 6 years while we reworked a lot of Medicaid for the developmentally disabled. I'm the president of Autism Society, and I'm a health insurance broker. So I'm going to talk to you about the Disabled Adult Child Program. It's a program that a lot of people don't know about, and it has some excellent benefits. So we're going to get started. Okay, so the plan is we're going to cover a little bit about Social Security, the Disabled Adult Child Program, which is a program within Social Security. We're going to talk about Social Security disability, access and all-tax, Medicare, then dual Medicare plans, and original Medicare, and how all of this applies to health care for our disabled adult children. So many people will apply for supplemental security insurance when their child turns 18. And that is sometimes an easy process and sometimes a difficult process. The most important thing, I think, is making sure that Social Security has all the medical records. So one of the complaints that families tell me about is that they get denied, and when they get denied, they find out they were denied because Social Security didn't receive all the records. You can turn in all the records, but Social Security still wants them from the original doctors. So advice that parents are shared with me is you can ask Social Security for the fact sheet, and you can hand walk that into every provider and then make sure that they're actually submitting that documentation. Super important. So SSI is designed for those who are disabled, who have low income and low resources. So definitely if our adults are on all-tax, they're already meeting a lot of that criteria. You are going to make the case that your child will be unable to support themselves through employment or be underemployed. So there's many adults who are on SSI and able to work, and there's programs that support that. So you're going to submit a packet of information to Social Security. They're going to request all sorts of information from therapists, psychologists, teachers, that kind of thing, and then they'll make their determination. You can do it online. You're basically applying for any program that your child might qualify for. This is what the check sheet looks like. And autism is not a diagnosis where you're guaranteed into the program. And so you have to be able to prove that your child meets that criteria. So every application for disability benefits using the Blue Book, that's their manual, they have a list of all the conditions. Autism is one of them. You can apply for it if your child's over the age of 18. You have to demonstrate that there's limitations in activities of daily living, difficulty interacting socially for any length of time, trouble concentrating, completing things. Anything that you can use to justify that your child needs that extra support, you're going to want to include. So like applying for all-tax, we're not presenting our adult child with rose-colored glasses or on their best day. We're really presenting what kind of their worst day looks like. So you just have to think about what that looks like and have a realistic perspective if you think your child needs to be in the program. It's needs-based. It's financed by the general fund. And so there's really 3 Social Security programs, and a lot of us get them confused. So there's SSI, SSDI, and SS retirement. So we are specifically talking about SSI, which is supplemental security insurance. And it really is designed for the aged, the blind, or the disabled who are low income. And it provides cash for basic needs, and you do not need any work credits to qualify for it. So for SSDI and SS retirement, you do have work credits that you're paying into the system. So again, just like with Altex, the resources have to be under 2,000. So that's cash, land, stocks, bonds, things like that. The value of the house that your child lives in does not count as a resource. So when you're applying and if you get accepted, and I would say about half the families get accepted without a lot of effort, and the other half really struggle and sometimes have to appeal, and a few of them have had to hire lawyers. But hopefully you'll be lucky enough if you've applied for it to go smoothly. And again, I think making sure that everybody's faxing in the records is really important. If your child's approved for Social Security, you need to charge your child rent. So there's two different ways that you can choose to charge them rent. One's fair share, the other is rent as a tenant. You usually have to submit an annual report. I'm told that during the pandemic, they waived that, but it's probably going to come back. So when you're doing some of this stuff, you want to keep good records because you will have to show them at some point and you just don't know when. If you're charging your adult child rent, there's a lot of things you can do with that. You can open an ABLE account and you can put it in their ABLE account. You can use it for their support. There's lots of things you can do, but just remember, if you don't charge rent, Social Security reduces what they get by 1/3. So this year, 2023, they get $914 a month. With the approval of SSI, you also get access. So some people are on Altex, and maybe some people couldn't qualify for Altex. This is another way to be in Medicaid. To qualify for the to qualify for the DAC program, your child has to be over 18, diagnosed with a disability before 22, be on SSI because of their disability, have one of their parents retired, disabled, or who has passed away, parent has enough work credits, and the child is unmarried. So just because your child gets Social Security doesn't mean they're going to automatically qualify for DAC right away. And we'll kind of explain some situations of how that happens. So it allows a child who's disabled to apply on their parent's work record. So if my child were on Social Security and I was on SSDI, he could then qualify on my work record. He would get half of my full retirement without impacting my ability to collect my retirement from Social Security. And when both parents pass away, the child will get 75% of the benefit of the parent who had the highest earnings. So very important to know for long-term planning. 75% of a parent works record can be quite a lot of money compared to the $914 that they would get right now. So to give you an example, if I had my full retirement was $3,000 a month, then my son would get $1,500 a month. And I'm going to explain why that's important in a minute, but I want you to understand this pickle rule. So if my son applies and is part of DAC and he now gets $1,500 a month, his income is higher than what is allowed for access. The pickle rule protects all people who are on Medicaid, so access or All-Tex, from being removed just because when they went from SSI to SSDI, they're making more money. This is an extremely small group of people, and every once in a while, Access will make a mistake and remove someone from the Medicaid program when they should not have been removed. So I like to educate people about this rule. It's called the pickle rule, and it protects the person who is already on Access or All-Tex with their SSI. Even if they make more money, they still get to stay on the program. There is one exception, and that is you absolutely cannot be married unless you marry another DAC individual. So this is so important because I know a family and they called Social Security, and Social Security said, oh yeah, you can get married. And so the individual did, and they lost their DAC status, and it can never be undone. Even if they were to have an annulment, it doesn't matter. You've severed that benefit. If you marry someone who's also a DAC, then that's the only exception to that rule. So I currently have a client who is living with her boyfriend for now 15 years. And the only reason they're not married is because she cannot afford to lose this benefit, and being married would preclude that for her. You're absolutely able to work part-time, and there's a great program called Ticket to Work, and Ability 360 has a 4-hour class that goes into the details of all the different programs that allow you to work part-time. So, but we now have individuals who start working at 18, and maybe they're only working part-time, but they might earn enough work credits on their own. So if you're under 24 and you've worked 3 years, so you have a total of 6 work credits, then you would qualify on your own work record. So for 2023, a work credit equals $1,640. So if an individual has earned $9,840 before their 24th birthday, they will qualify on their own work record. So if they qualify on their own work record, they might have too little money. So you can actually have SSDI and SSI together. So if I worked, and so my SSDI was 500, SSI would make up the other, so I would be up to 914. So you would never be less than 914. SSDI gives cash benefits to people who have disabilities, and they had enough work credits. So under 24, you need 6 work credits. What's great about our kiddos, if they have SSI, they're in the DAC program, they don't have to have the work credits. They can qualify on the parents' work credits as well. So it's 2 different ways for that to actually happen. So, okay, I'll answer your question 1 second. Can you work if you get SSI or SSDI? And yes, you can. So remember I said Ability 360 has a class. They have a DB 101 class, and they have a great website called DB 101. But they have an even more in-depth in-person class, which is 4 hours long, and it goes over to Ticket to Work and a bunch of different programs that are within that. So once your child gets SSI or SSDI, you need to make sure you're still maintaining all of your records, because they will ask for an annual report, and they'll do a disability review and redetermination every few years. I did have one family have to fight for 3 years for their adult child to get SSI, and they are now being paid $32,000 because they're backdating it to the date that they applied. Okay, so who raised their hand? You feel free to unmute and ask a question.
Yeah, I'm just wondering, you keep saying DAC or JAC program, and I don't know what you're referring to.
DAC, Disabled Adult Child.
Okay, sorry.
No, that's okay.
I just needed to know because you kept saying it. Thank you.
Disabled Adult Child Program within Social Security.
Okay, thanks.
Does anybody have any questions so far? Because you can feel free to unmute and ask a question if you'd like.
I have a question.
Yes.
With the income, with the ABLE account, from everything I've been reading and trying to understand, that's literally just a savings account. But what if my child wants to have like a bank account because he gets money and he wants us to be able to use it on a regular basis? Is that still an ABLE account, or would that be separate?
It's separate, but what you have to be careful about is you can't save money in a checking account without endangering you from qualifying for Access or Altex.
Right.
So if they put in $900, but they spend the $900 on things, that's fine. But if they start collecting money and not spending it, and pretty soon they have $3,000, then they have too much income. So that's why an ABLE account is great, because it's a way to save without impacting benefits. And I'm not positive, but I think right now you can save $114,000 before it impacts benefits. And obviously not in 1 year, but it does, it's protective. So it allows people to put money away.
So if he's utilizing an account and like getting money, spending money, it's okay for him to have like an account with like my help on there. But then if he's just wants to save it for some reason, have an ABLE account to use that, because from what I was reading, like it was really restrictive on what you could use the ABLE account for once it's in there. Is there a good resource that's besides just looking up the ABLE Arizona?
If you, so I'm not an expert on ABLE, but what I can say is, but I'm an expert on Medicaid. So Medicaid, you have to be really careful with how much income he has in an account. So you don't want it to go over the limit. And that's why people use ABLE, and you can use it for a variety of things. Therapies. I mean, I have friends who use it quite frequently, and I haven't heard them having a lot of trouble with it, but I have to say, I'm not an expert on ABLE. That's not my expertise. But I would just be really careful about when you're using that checking account, that you're making sure that it doesn't ever get too high, because then it can affect benefits and you don't want those to be impacted.
Right. Okay. Thank you.
You're welcome. And Charity, I think you raised your hand.
Yeah, so one of the questions I had, kind of following along with what she was asking, okay, so with an ABLE account, does that mean that he cannot, so let's say we open an ABLE account and my son also has his checking account, which he has right now. It'll never go over the 2,000. But does that mean that he can't make more than 2,000 a month? Or does that mean if he makes more, which I'm not sure he would, but I'm just trying to understand, if he makes more than 2,000 a month, he could put it in an ABLE account and it would be okay?
Correct. Because the thing is, you don't want the checking to go over that amount, or then it endangers your benefit, right? So that's why people use ABLE accounts, because it's a way to put in money. So a lot of families will charge rent and then put that 1/3 of that money into an ABLE account, because you couldn't put it in a savings account, because then it would count towards your benefits, and every year Access and Altex is going to ask for financial information to make sure that you fall underneath that number.
So that makes it fall, I'm sorry, that makes it fall under that number, right? If it's in able,
Correct.
if he earns it, because everybody keeps pushing me towards the DB 101, but I still haven't understood, you can look at if you make a certain amount, but yet the whole able, it's been confusing. So,
well, there are different things too. Okay. So able's one thing. It's a nice way to put money away. DB 101 is like a general class that they have, but they have I think they have a 4-hour class that I took that was on Ticket to Work and all the different employment programs and how much you can owe and what the math is around that. And the math is pretty complicated. So it's important to go with your child in mind. I went without a child in mind, and my head was swimming a little bit because I couldn't relate it to an experience for just myself. But it's an excellent program, and they teach you how to do all the different math around it. And I have several families that I know whose children are working quite well. So I have a friend of mine's child who's working at a hotel. He qualifies for SSI, but he never gets any money from SSI because his earnings are too high. But he still keeps that designation. And when we move forward, I'll explain why that designation is so important. So as people are being more included in our society and are able to be more employed, there are different ways that you can structure income and those kinds of things. And I highly recommend that class. It's really good. Did other people have questions?
Yes, I did, Andy. I raised my hand. Maybe you didn't see it. Can you hear me?
I can hear you.
Okay, I had a question about getting the Social Security and then charging them rent and a third of it taking that as rent. If we're worried about she's going to be maybe making too much money, our daughter or whatever, can we raise the rent? Do we have to document this rent just to keep her from going over that threshold? Do we have to say exactly what it's spent on? How detailed are we going to have to get?
So yes, Social Security has 2 different ways that you can do that, and they are pretty detailed. Once she pays you that's rent you took, because so you don't have to say what you spent the money that she gave you on for rent. And you can look at the 2 ways. So one way is to look at what all of your expenses are, like electricity, gas, mortgage, and then you can split it among the people that live there, or you can just do a straight 1/3. There's several different ways to do it. And you do want to document what you're doing, because Social Security can at any time ask for you to report what you've been doing. But ABLE is a nice way to move money so that the account doesn't go over the limit.
Are there any restrictions on what she can spend her money on? Say she's getting this Social Security and we've already charged her rent, and she's decided that she wants to go buy something. Does she have to document Okay, so it's not like, I want to go buy a dog and you can't stop me. Social Security's not going to get mad that she's paying for dog food. It's her spending and she's fine.
It's her spending and she's fine. And really, when you think about it, luckily they're not policing that.
Okay. Yeah, that's what I was worried about. Okay.
Yeah, exactly.
Okay.
I have a question.
Yes.
Can you hear me?
Uh-huh.
Okay. I'm listening to this and I'm thinking, does this all pertain to kids who are already working? My grandson is 16 years old. He's still a sophomore in high school. He's not working. So I'm kind of assuming that.
So what we're talking about is when your child turns 18 or your grandchild,
Okay.
They can apply for SSI.
Uh-huh.
And then once they apply for SSI, they'll eventually qualify to be part of the DAC program. Some people have children who are going to work part-time, and so that's why they're asking that question. But SSI is specifically for people who are either going to be underemployed or not employed.
He is receiving SSI now.
Yes, but when he's 18, that situation can change.
Changes. Okay, so he has to reapply.
They do reapply.
Okay.
Yes. Exactly.
Okay, now I'm not quite sure what an ABLE account is. I know they're going to have another training. I'm wondering, will they be talking about this ABLE account? I'm not familiar with that.
I'm not sure. We have a transition to adulthood class that we offer. Autism Society offers every month, and we do go over that. And then I know that like Emily Kyle and Emily Taylor and Karen Strabowski, they all talk about that too. So yeah, there's a lot of information about the ABLE.
Okay.
Yes, Cynthia, ma'am, we're going to have another training on the 8th, which is
Yes.
going to talk about financial planning. And so she may have more information on that.
Okay, that's what I was thinking. That's what I was. Okay, thank you.
Okay, you're
Mhm.
welcome.
Okay. Okay, so any other questions, or are we ready to move forward? Because I can't see all hands. So
I have
I
one
missed some.
more question. Oh,
Yes.
Is there like a legal form that we have to fill out for charging them rent? Or is it just a write it on a piece of paper saying we're charging X amount of dollars for rent?
That's a really good question, and I will find the answer out for you. I'm imagining that there is a form that you have to submit, because if you don't submit something for Social Security to see it, they're automatically going to cut the income by 1/3. And I can't imagine Social Security not having a form, but I'm not sure what the form is called.
Okay, all right. And you don't know,
Yeah.
I'm guessing, if there's like limitations to, like the other gal was saying, how much you charge for rent. So he's got 100 square foot bedroom, so we can only charge him, $50 for that and a bathroom. So there's another 50. So we can only do like 100. Or is there okay, we're going to charge you $300 a month?
So most people do it, just charge them 1/3 of like their Social Security, which is what Social Security would take if they weren't paying rent. But there is two formulas that you can do. So I think most families just take 1/3. It's just easier that way.
Okay,
So
that makes sense now. Thank you.
I have a quick question. This is Charity again. I just recently, my son turned 18 and I just applied for Social Security. And when she was doing the intake, she asked me, is your son going to pay rent? And I said, yes, because I had heard kind of this, but then she said, how does he pay rent? He has no income. And I was like, I was told to say that he's going to pay rent, but she said, I'm putting no rent because he has no income. So what do I do now that they haven't finalized it, but everybody keeps telling me that I should be requiring rent?
Once he's approved, you can update that.
Okay, thank you.
And my experience with Social Security, and it's always changing. I swear they change the rules like every month. But my experience has been, it is better to walk into a local Social Security office and talk to someone than calling the 800 number. Most of the people who answer the phone for the 800 number are appointment setters. So you really want to go into the local Social Security office. And if you're having trouble, you can always ask, I think it's called a Title II supervisor, for help, because they're the ones that are really experts.
Thank you so much.
You're welcome. Okay, So we're going to move along and we're going to do a little bit about healthcare because this is where it's going to really make sense why this program is going to be really important. So if your adult has just access, that's medical for low income. Your child can also have all-text EPD, that's Medicaid for elderly or physically disabled. Or you can have all-text DDD, and that's for the developmentally disabled. All three programs are Medicaid, they're just different programs within the Medicaid system. The majority of our individuals either qualify for access or all-text DDD, but we do have families who also qualify for EPD. So someone can fall into one of these three programs. And access, so once you're on access, they pay for just regular medical stuff. So doctor's appointments, emergency care, surgeries, behavioral health, specialists, that kind of thing. All-text offers long-term benefits. Those are not offered by access, only all-text. And that's like hospice, nursing home, home health, attendant care, homemaking, habilitation, respite, day treatment programs, group employment, that kind of thing. So some people qualify with access and they don't get to use some of this programming that people with all-text get. So all-text for EPD or DDD are a higher needs population and then qualify for this additional benefit. EPSDT, early periodic screening, diagnosis, and treatment, ends when you turn 21. So let me explain what this is because so many people do not know about this. What the federal Medicaid program says is if you're under 21, you qualify for EPSDT services. And that medical definition of what medical necessity is more liberal than you would see in an employer plan. And what it says is, if you can prove that something will ameliorate your child's condition, even if it's not a covered benefit, the state has to pay for it. So we used EPSDT as an argument to get the state to pay for ABA therapy and other behavioral health services that they had said were experimental and wouldn't pay. People in other states have used it for hyperbaric chamber, for CP. And so this medical necessity definition is the most liberal definition that you will have in a lifetime, basically. And it ends as soon as you turn 21. And it was designed because Congress didn't want to deny children something that later proved to be really important. So that's why you have this liberal medical necessity definition. And so when you get older, over 21, some things change. So home and community services are still going to stay with DDD, so that's respite, habilitation, attendant care. OT and speech will still stay with DDD when you turn 21, but PT will go to the health plan at 21. Speech therapy, once you qualify for Medicare, may not be provided by an assistant. It has to be a speech pathologist. And I know most of us are like, well, you don't get Medicare until you're 65. Well, the DAC program, you will qualify for Medicare before 65, and we're going to talk about that. Dental is covered for access and all-text members under 21. It is considered an EPSDT service. So is vision and hearing. When your child turns 21, if they're on access, they will no longer get comprehensive medical. They will only get $1,000 emergency dental And emergency dental is truly that. It's not a cavity. It has to be a real emergency. All techs, so that's EPD and DDD, you will get $1,000 of dental and $1,000 of emergency dental after the age of 21. Yes, Maria.
Thank you. I have a question about Altex. My son have what they call high prophecy high his high in his autism is lower. He can be almost a normal kid, but he's getting blind. So
No.
yes, he have
Okay.
and myopia degenerative. And so if he can be a person who can have Altex too, or Medicare.
So being blind, unfortunately, doesn't make you automatically qualify for Altex. But you would apply under the EPD program. And there's an EPD pass tool, which I have, and I'm happy to share with you. And you could read through that to see if your child would qualify under that.
Okay, thank you.
You're welcome. I saw 2 other people raise their hands, but I can't see who. So someone just jump out and ask a question.
Maria or Sophia have their hands raised? Okay. We'll keep going.
Okay. So the dental is really important because when our kids are under 21, we don't think much about it. And people with developmental disabilities tend to have higher dental bills. So this is a big change. So EPSDT ends at 21. And so that affects vision, hearing, and dental. So when you're on SSDI, after 24 months, you qualify for Medicare. And so when you apply and you get on SSI, once a parent either retires, goes on SS retirement, becomes disabled themselves, or passes away, the DAC adult child will immediately transition to the DAC program, and they will be getting SSDI. And after the 24th month, on the 25th month, they're going to qualify for Medicare. And I'm going to explain a little more about that, but first we're just going to go over a little bit of Medicare first. So these numbers are for 2023. So Part A is what people think of as hospital, and there's a deductible of $1,600, and that resets every 60 days. And then there's copays for being in the hospital long-term over 60 days and 90 days. Skilled nursing also has some costs associated, $200 copay after day 21. So there's a lot of costs with Part A that people just don't know about. And then Part B has a deductible. The standard deductible for this year is $164.90. And that's like your medical stuff. So that's your doctor, your specialist, your surgeon, your ER, your labs, your MRI, your ambulance. And the Medicare pays 80% and you pay 20%, and there's no out-of-pocket maximum. So the first thing that's important is the Part B premium. So some people don't want to start Medicare for their adult child because they're like, I don't want them to have to pay the $164.90. Well, you don't need to worry about that because all techs and Access will pay the Part B premium for someone on Access, Alltex, EPD, or DDD. So that premium should not be taken out of by Social Security. However, I have had families contact me. I had 5 families contact me, and they were taking out their Part B premium when they shouldn't have been. And I'm told by Access, because I elevated it up to Jamie Schneider, who was the head of Access, that they had a glitch in the system and that they fixed it. But I like to raise awareness with families that if your adult child has Access, Alt, or Altex, they are not paying that Part B premium. Yes, Charity.
So my question was, my son right now is on Altex and we're waiting to be redetermined. Is this only, because I keep reading that Altex is Medicare, but when you just showed the blue card and then some other things and you're
Altex is
talking
not
about
Medicare.
it is not
Altex is Medicaid.
Medicaid. So
Correct.
you're talking about when he's an adult, it could be Medicare if he follows the DECA, but there has to, a parent has to be deceased, right, for him to qualify for that? Is that true?
So let me give you a few examples. So let's say one parent died before the child was 18. When they applied for SSI, they got approved at 18. At 20, a Medicare card shows up because they had a parent that had passed. Or the child's 36. The father just retired and went on SS retirement. Now the clock starts ticking for that 24 months. And then on the 25th month, the Medicare card will show up. Some families choose to have one of the parents go on SS retirement at 62 so they can start that clock. That's like a personal decision that you're going to make with your financial people, but you don't have to be dead. You just have to be getting SSI. The child has to be getting SSI. The parent has to be getting SSDI or SS retirement or has passed away.
Okay, thank you.
You're welcome. Okay, so when
can I ask one more question? I'm sorry, I apologize. This is Andy.
Yeah, no, go ahead.
As far as insurance is concerned, can we buy supplemental insurance for our child once they are on SSI and getting the Medicaid? She's already on Altex, but when she gets older, can we buy supplemental insurance for her in case she has a hospital stay? We want her to have an emergency backup. Will that hinder anything she's on through the government?
That's actually a more complicated question than it should be. But let me explain. When she has Medicaid and Medicare, the Medicaid acts like the supplement. Mm-hmm. So original Medicare pays 80%, and then the Altex pays the 20%.
Okay. And even the hospital, what got me is your little hospital stay there over so many days, so on and so forth. That would still be covered. Right. We wouldn't have to worry about supplemental. Would pick up. Okay. All right. That makes sense. Yeah. Okay. Thank you.
Yeah. Yeah. No, I know, because it could seem a little scary. And then I'm going to give a little bit more information as we move forward about that. So normally when you're 65, you have a choice. You can pick a Medicare supplement or you can pick a Medicare Advantage. I like to think about it as cake because all cake is good. You're just trying to figure out which cake do you like. However, that is not the same for someone under 65. So in this state, you cannot legally have a Medicare supplement if you're under 65. In this state, if you qualify for Access or Altex, it's really illegal for me to sell you a Medicare supplement because the original Medicare and Altex work together to provide 100% coverage. So they don't want you to do that. Once you turn 65, then you have that choice again. And I'm going to explain some ins and outs about that. One of the things that is so important is that a Medicare card could just show up and it just arrives. I can't tell you how many families have called me and they're like, a Medicare card came and I don't know why. So sometimes you're automatically enrolled in DAC, and sometimes you have to tell Social Security you want to be in DAC. But what happens is once you're at that 25th month, you qualify for Medicare. And what our state does is we automatically enroll you in a dual Medicare Advantage plan. And the reason that we do that is that you get enhanced benefits, and they believe coordinated care produces better outcomes. However, they don't really understand the way that the system works. So I'll give you an example. I'm helping a family. They're on United Healthcare Community Plan. I'm looking at the United Healthcare Dual Plan. Their doctors are in the United Healthcare Community Plan, but not in the United Healthcare Dual Plan. Well, I thought that was strange. Then I was helping someone with Mercy Care. So I started keeping a list of doctors that were in the Access plan, but not in the Medicare Dual Plan. And I went to Access and the head of United Healthcare and Mercy Care, and I said, why are your networks not aligned? And they said, they are aligned. And I'm like, no, they're not. And I sent them a list of doctors that I had already found that were on the Access plans, but not on the dual plans. And United and Mercy Care both said, oh, we don't think that's true. And then Access said, well, we would like you to run a report. And what did we find out? The networks are not aligned. So just because you have doctors that accept the Access plan doesn't mean that they're going to accept the dual plan. And let me give you an example. Phoenix Children's Hospital, which a lot of people use for neurology and a lot of people still use as an adult, they're on all the Access plans, but they're not on any of the dual plans. So that neurologist was the most important doctor to your child. By you being auto-enrolled, you have lost that choice to see that doctor. So I advise all families, when you are notified that you're being auto-enrolled, that you contact the plan and say, do not auto-enroll me. And you take a moment and do some research. And I'm going to explain a little more as we go through it. So Medicare Advantage plans is another choice. And they have additional benefits too, but they might have a different network. So I have a client who is All-Tex DDD, but she has a gastroenterologist that doesn't accept any Access plan. He accepts Medicare Advantage plans all day long, but he doesn't accept Medicare, doesn't accept Medicaid plans. She found this doctor because she was on her parents' employer plan, but they just retired, so the employer plan doesn't exist anymore. So we found a PPO where she can see all of her doctors and not pay copays with her Access plan, but she still gets to see her gastroenterologist for $20 a visit and has that coverage. So it has less additional benefits than a dual plan, but it gives you extra benefits like dental, vision, hearing, gym membership, that kind of thing, but maybe more freedom to see a doctor because doctors are important. Or sometimes people choose this. They keep their original Medicare, they keep Access, and then they pay for a Part D. And really, Access pays for the Part D. Now, why maybe you would make this choice? I have a family whose son has had cancer. He was treated at Mayo. They want the option to go to Mayo. Mayo doesn't accept Access. Mayo doesn't accept Medicare Advantage plans. So they would use their Medicare. They would pay the difference because Access doesn't do that. But then all other doctors that they see, they would have zero copays. Their prescription coverage would be paid for by Access. But once you qualify for Medicare, you're required to have a drug plan. So it's really about doctors, networks, benefits, and pharmacy and prescription drugs. And there's no right answer of what choice you would pick for your adult child once they qualify. What's really important is having a strategy that's going to work for your your child's specific needs. And so that's one of the things I do is I look at all the different choices, what's important, what doctors, what benefits are important, and then we decide how to move forward. One thing that's important to know, and this is important whether you're Medicaid access, Medicaid all text, or and you have an employer plan or Medicare or whatever. If a provider is access registered, they cannot charge you a copay. So let me give you an example. You have an employer plan. You're going to this doctor that doesn't take your access plan, and he wants a copay. If he is access registered, it is illegal for him to ask for a copay. Even though he doesn't have a contract with your health plan, even though he doesn't have a contract with any of the access health plans, if a provider is access registered, they cannot balance bill you, which means ask you for a copay. So let's say you go to an ABA company and you have Blue Cross Blue Shield with your employer, and they take that, and then they say, okay, your $6,000, you owe us that. If they're access registered, they can't collect $6,000. It's not legal. So who pays first? If you have original Medicare and all text or access, Medicare always pays first, Medicaid always pays second, Medicaid is always the payer of last resort. Same with an employer plan. Employer plan pays first, access all text pays second, Medicaid is always the payer of last resort. Let's say you have an employer plan, Medicare and Medicaid. If you have an employer that has over 100 employees, the group plan pays, then Medicare pays, then Medicaid pays. If you have less than 100 employees, then Medicare pays first, the employer plan pays second, Medicaid pays third. I really encourage families when they're getting close to retirement to have a transition plan to move towards a Medicaid, Medicare situation or Medicaid situation and really use that plan well, because when you leave that employer plan, you're going to only be using your access plan, all text plan, or a Medicare, Medicaid situation. And you want to make sure that you have doctors that are going to work with that. Not all employer plans do. So I just talked to a family a couple of weeks ago. They're retiring in 2 years. We're building a transition over the next 2 years to find some new doctors, because when they lose that employer plan, there's 2 doctors that they're going to lose that do not accept Medicaid, are not access registered, and so that's not going to work once they retire. So what I do is I make sure you understand what all of your options are. I help you figure out what the right thing is to do. I advocate inside the plan. So I answer questions. It's really my favorite thing to do. And there's so much people don't understand about healthcare, whether it's your employer plan, your Medicaid plan, or your Medicare plan, and how everything works together. And so that's what I do. And then when things go wrong, I can advocate inside the plan, which is how I knew that the Part B wasn't being paid for by Altex. I had 5 people tell me when Access did a deep dive, they found that they were doing this to 125 people and had been for many, many months. And nobody said a word because they didn't know any better. But I called it out, and the next thing you know, they fixed it. So it is really important to just stay connected to this kind of information. If you guys want to contact me, here's my contact information. I answer questions about Medicaid, Medicare, employer plan stuff. Employer plan's a little bit harder because each employer plan is different, but some of the basics of who pays first and how and why, I'm happy to help with that. and always happy to get an email from someone if you're having trouble with coordination of care between an employer plan and Medicaid. I'm on a committee with the Access Health Plans, DDD, on coordination of benefits and making that go more smoothly. So healthcare is my passion, and I'm willing to take a bunch of questions now if you guys would like.
Thank you, Miss Cynthia. I'm sure some families might say, how much do you charge?
Oh, I don't charge anything.
There we go.
So
I say that because, yep.
If you enroll in the plan pays me. But my advocacy work, I'm very connected with lawyers and Access, and I'm always willing to help a family. Like, I don't know if you guys knew, but it was me that got Access to change their position on difficulty of care income. So I had several families that Access was removing from Medicaid because of the difficulty of care income. And the IRS views that difficulty of care income as not income. So when I asked Access why they were doing it, they said that was just their policy. There's 47 other states that view it that way. I submitted a ton of documentation. Then I sent it to a bunch of lawyers, and then lawyers started asking questions. And the next thing we know, they've rewritten their policy. Difficulty of care income is not included anymore. And that helped a lot of families. And I never would have known it if someone hadn't contacted me, but I never charge for helping families. And then when they enroll in a plan with me, then they belong to me, which means I'm allowed to advocate for you.
Thank you. Questions? I know we have Jacob, your hand is raised, I do believe.
Yes, thank you. Well, I'm glad you mentioned the difficulty of care income, because that was literally, I just found out about that this year. So like I just started redoing my taxes and trying to figure that out. And with that, I was gonna ask, initially I was a single mom. My kid was getting SSI, and so I also got Access as well. Then they switched me to an Access caregiver, and now I just got word because I got married that they were going to take me off of it because of my husband's income. Well, my husband is doing, because he's not biologically my son's, he's doing HAB and respite. So now we can qualify for the difficulty of care income for my husband. But I know that's probably going to change like when we do 18 and I get guardianship, and I'm not sure how that's going to go. So I guess my question goes with, can I still get Access because I'm taking care of him like as a caregiver?
Qualifying for Access is based on income only. Now, they can't count your difficulty of care income, but they can count it's tricky because they can count your husband's income for some of it. So it really depends on where your income lands. What's important to know is once your child's over 18, difficulty of care income still is not considered income, as long as the child or the adult child is living with you. But difficulty of care income is, I think, attendant care and rehabilitation, but not respite. Have you updated Access with your guys' incomes and where that income came from?
I have not. Like I said, I literally just found out about the difficulty of care this last like 2 weeks ago. So I was going to call them and say, look, my husband's income is a difficulty of care income, and see what they say. And then
Okay,
like,
so if they don't understand what you're saying, or they disregard what you're saying,
yeah,
because that does happen, just shoot me an email. I elevate it to the person in charge of that. And I just had a couple families have that same situation, and we were able to get it fixed in less than a week.
Okay. And with transitioning, I'm hoping to be able to provide, like, I'm going to be his guardian, and then I'm going to start providing services for him as well, because my husband's like kind of hoping to go back to regular work. So would I then still be able to provide difficulty of care income at that point, or no?
Well, you're able to provide difficulty of care, like you're able to do that work, and that's still difficulty of care income, but Access will look at your husband's income with his employer, and if that puts you guys over, it puts you over.
Right. But if we're both in a sense doing difficulty of care, because like say I'm doing attendant and HAB, and then my husband's doing a little bit of attendant and HAB or attendant or whatever, is that able to happen? Like, can both parents provide? Well, because like I said, he's not biologically his. So are we able to both provide?
Based on biological, you're only allowed, according to Access, and there's a lot of debate about this, and there is a support group on Facebook that's just for families that are paid parent providers.
Yeah.
But according to Access, you're only allowed to work 40 hours a week within the family for that child.
Okay. Okay, but so if, say my husband gets a part-time job, I have a part-time job, and I'm doing 20 hours a week, he's doing 20 hours a week, then we both claim like those 20 hours a week, we do the math to figure that out at tax time, correct? And then is it all of, because I know there was like the option of count all of it as difficulty of care and count half of it?
So that is a question for your financial advisor. My licensure is health insurance.
Sure.
The only reason I'm involved in difficulty of care is because people came to me who needed help enrolling in a marketplace plan because they were losing Medicaid. And when I went to do that, I'm like, but they're including income they shouldn't be including. And so the next thing I know, I'm advocating for a change. But so how you do your taxes, I can't say.
Right. Okay. Yeah, no, I guess it's like I said, I just found out about this difficulty of care, and yeah, I'm going to call Access and be like, hey, so they can't count my husband's income then because of that, correct?
Not if it's difficulty of care income. No, they can't.
Okay, great. Okay, thank you.
You're welcome. And I saw, was it Charity that had her hand up?
Yeah, I'm not sure that this is the place for this, but somebody told me that because my son is 18 now, that according to the McKinsey-Vento Act, he would be considered homeless, and that I should be putting homeless on his application for benefits as an option according to the McKinsey-Vento Act. And I just wondered if you've ever heard that. It was a caseworker.
That.
Okay.
I've never heard that. And I don't know what extra benefit are you going to get from saying he's homeless?
I have no idea. They just told me. So I haven't filled that out or done anything with it, but they just said that that is what I should be putting, because technically as 18-year-old he is. So after I heard you say it's mostly benefits, huh?
If you shoot me an email, I'll talk to a couple of attorneys and find out what the story is on that.
I would appreciate that. Thank you so much.
Yeah, email that to me.
I'm sorry, I work with McKinsey-Vento, and in order to be homeless, you should be living with someone who is not your family. You've been sleeping in the car, you've been sleeping in the hotel. So just because he turned 18, that doesn't make him homeless. You are
I
in charge
thank you,
of
Maria,
him.
because I've never heard that before. What she said, I had never heard before, but I'm like, I always double check my facts. So thank you for answering. I appreciate that. And I haven't heard families doing that. And we have enough actual, I've helped quite a few, and I don't do homelessness either. I don't know how this happens, but people just know me. And so they contact me. So a social worker from a hospital contacted me about a family that was truly homeless, living in the Walmart parking lot out of a car. And what was really sad is if you have if you have a child over, I don't know if it's 12 or 14, but if they're the opposite sex of you, it's very hard to find a homeless shelter that'll take both of you. And the mother was refusing the homeless shelter because her son would have to be by himself in a different homeless shelter. And so then they viewed that as refusing help, which it certainly was not. And I have to say that I contacted United Healthcare Community Plan, and they actually drove around and found them at the Walmart and put them in a motel until they could connect them to service. So there's just so much that's happening with our families these days that are really struggling, and homelessness is going to be a bigger issue, I think, for our families. Is anyone a Ruben?
Yes, I want to go back to the person that was talking about, I received, like I say, he's 16. And during the pandemic time, I'm his guardian. And they allowed me to be, I guess they made the exception to be to do attendant care for him, which was like 13 hours a week. Okay, and I get those newsletters, then I think it ended. But I get those newsletters and it specifically says that they've extended that to 24. I've asked my case manager, and I said, she goes, well, you can do rehab or you can do habilitation. And I said, it doesn't say that. It says attendant care. I'm caregiver. And she said, and then she keeps telling me, she goes, no. I said, that's what the newsletter says. Then it can't be more than 40 hours a week. Now,
so there's two different programs that we're paying parents as parent caregivers.
Yeah.
And one of them is sunsetting, and one of them is going to 2024.
Mm-hmm.
So I'm not sure like which one falls under, because again, I got involved in difficulty of care because it was around actually insurance. So people were being kicked off of Medicaid. That's how I got involved. So I do know that there was two programs, and one program is ending, but the other program is continuing to 2024. And Access and DDD asked for it to be extended longer than 2024. And so far, what we've heard from CMS, which is Center for Medicaid and Medicare, that they're not interested in doing that. So we'll see. It's still a work in progress. And again, there is a parent provider support group on Facebook that keeps parents up to date on the policies and procedures around that. And it's an excellent Facebook group. So I would look for that so that you can stay connected. But my other advice to all families is I don't believe anything that anybody ever says to me ever. So if I don't see a policy, if I don't see evidence of coverage, if I don't see something in writing, then it's not true. So when he says something, I say, where's the policy? When Access says something, I say, where's the policy? When I look through their website and I can't find a policy, I email them and go, where's the policy? Because everything should be in writing. Yeah. Everything in writing. And so there's so many people, so much turnover, so much change that we can't assume that people necessarily know. So I'll give you just like an example from my world. I have a client diagnosed with a very rare cancer. There's only 2 doctors in Maricopa County that treat that cancer. His insurance plan that he's on is not contracted with either of those doctors. One's at Barrows, one's at Mayo. There's no way that he could see either one of those doctors. When I called the carrier and I asked for a procedure for a single case agreement, they told me there was no such thing. And I said, well, that's interesting because on page 96 of the evidence of coverage, let me read you what it says. And I read it to him. Next thing you know, I have a single case agreement. So always, always ask for everything in writing.
Okay. Because I mean, I've gotten, and I've asked 3 times, and I'll say, okay, I hear what you're saying, but this is what this newsletter says. Well, let
What
me
is
ask.
the newsletter from?
I'm sorry?
What newsletter?
It's one from DDD. It's from DDD, and it talks about you know how it's been extended. Parents can be paid caregivers, and I tell them I used to do it through Good Neighbor, and they gave me 13 hours a week, and then it says because my grandson's speech therapist is doing it. She goes, yes, they are doing it. And I said, I keep asking, and the girl, I've been several case managers. I had none for a while, and somebody filling in, I guess.
What does your agency say?
Well, they tell me that it can. You mean like Good Neighbor?
Yeah.
Yeah, they tell me, yes, it can. You can. And she goes, I tell them this. And then I tell the girl, and like I said, I've had like 3 or 4 different ones. They don't last very long. The case managers.
Okay, this is what I would do. This is what I would do. Call DDD OIFA. So every health plan has an OIFA. So every Access health plan has an OIFA. OIFA stands for Office of Individual and Family Affairs. Leah Gibbs is the head of DDD OIFA.
Can you say OIFA? OIFA?
OIFA, Office of Individual and Family Affairs. So United, Mercy Care, Banner, Care First, Molina, they all have them. If they're an Access plan, they have an OIFA. DDD is an MCO. So they do have an OIFA, and it's Leah Gibbs. So I would contact the OIFA department within DDD and ask for help.
Okay.
Okay. Charity, I see your hands up.
I was just going to add, if I was understanding her correctly, you can be paid for attendant care and habilitation at the same time under the ruling. So if that's what she was asking, and my DDD newsletter actually said that. So I'm just not sure which one she's referring to.
Saying.
Yeah.
But her coordinator tells her no.
Yeah.
So, yeah. So that's why I would go to OIFA. So, and actually everybody should write that down. You all have a health plan. So you might have United or Mercy Care, whatever, but they all have an OIFA department. So if you're ever having trouble with the health plan or DDD, OIFA is the advocacy organization inside the health plan.
Okay. Okay.
So
call DD.
DDD. Great resource.
Call DD and ask for the OIFA in DDD, right?
Correct.
Okay.
Correct.
Okay.
So, and OIFA is great. Like if you have an issue, and also Access has OIFA too. So I had an issue with a client and I couldn't get the health plan to do what they were supposed to do. So I emailed the head of OIFA for Access, and I'm telling you, 5 minutes later, it was done. Because Access doesn't play, like they're, everybody has to follow the rules. So, and I'm a rules follower. That's why I'm good for advocating for my clients and helping them find the right plan. And I just want you guys to understand that when your child turns 21, they lose a bunch of benefits because of losing EPSDT. And that's why qualifying later for DAC is so important, because it qualifies them for Medicare, gives them more choices, and usually gets them a lot more money.
I see. Okay. Okay, thank you. That's been helpful.
You're welcome. Does anyone else have any questions? Give me a problem. I love.
Miss Cynthia, thank you so much for doing
Yes.
this. You are really such a wealth of knowledge.
Yeah.
And I really just think you're a great resource for, you know, like all of the families out there in moving forward. We just are so lucky to have you in our community and are there to help. We are recording this. We will post it for people who weren't able to write everything down. And then it will also show your information if they need to reach out to you for any reason. We're so excited you are here. We also have another training on Wednesday that is specifically about financial planning and guardianship, which is just, it's such a good segue into that too. Just so much information just to help support families in their kind of journey through the process.
Thanks for having me. It was so much fun. And if you guys ever need anything, let me know.
Thank you, everybody, for your time tonight. We really appreciate you all joining us.
Thank you.
Thank you so much, Cynthia.